know, right?
Somebody want to call Ed Bloomer?
I thought he was on. Wasn't he on before?
I didn't think so.
Oh, I thought I saw him.
All righty, we are now live.
All right, welcome for committee meetings for Wednesday, May 5th. We'll start off with Health Services Committee.
Good evening, everybody. We open up Health Services Committee meeting at 6:02 this evening. We notice that we have Kim Kaplan and Laura Churchill on this evening. Hello, ladies. Kim, did you want to give us a recap of what's going on in your department?
Sure, thank you very much. So we're going to focus on COVID. So active positives currently 77, so still quite active, a lot of positives. And so we are still contact tracing 7 days a week. We have 14 in the hospital. Sadly, we have had over the last year and change 70 deaths. And currently we have 491 residents on quarantine. So as we know, we've really turned to focus on vaccines. That's been everybody's interest, and that was time, and it was available. So thank you to Dan and Penny organizing the pods, all of our public health nurses for being everywhere in the county and doing these pods. Thank you to the staff from other departments, and a special thank you to all of our volunteers, including members of the legislature who have been doing this work. We have some volunteers that started on day one of testing, and they are still volunteering with us, so it's very impressive. We've shifted our focus a bit now that the vaccine is available, because it was not to them before, on 17 and 18-year-olds, and we did 24 today. And we're looking forward, possibly next week, to having approval for a slightly younger age group starting at age 12. So we're waiting for that. To date, Greene County has given 15,000 vaccines, 7,000 with their vaccine series complete. And then looking at the state site for all sources, in Greene County, 16,828 with a complete series, and 21,161 who have had at least one dose. Does anyone have any questions about COVID?
Tim, this is Mike. How many, when you say the active cases, are these active cases in a lower age bracket? Are they seniors, or has a large portion of our seniors already received the vaccine? Do you have a breakdown on the percentage of the risk classes that have received vaccines?
I don't have that breakdown. I know that Dan was collecting the breakdown by age and so forth as they were allowed to register, because that was actually a requirement. As you remember, when it was 65 and older, and then it was 50, you know what I mean? So that he did do a breakdown, but I don't have that off the top of my head. As far as the active cases, I know that we have a real mix. We have had tremendous amount of activity in the schools in the last few weeks, which is expected. So it's really a mix. I'd say, just anecdotally, all ages represented just about, and we've seen that throughout. Our database, which is the state database that we use for positives and for quarantine individuals, it takes all the age information, but it doesn't correlate a report by age. But I'm sure we could arrange that. But just from what we see with our daily tracing, it is a real mix of ages, all ages, and the severity of disease and symptom is very unpredictable.
Okay. Thank you.
Tim, it seems like, at least what I'm hearing, national news, that that it's a younger generation, you know, in the 20s and this and that, that, you know, their personal prerogative, they don't feel comfortable taking it because they think they're gonna, it's just a flu. But also, if that is the belief, they'll realize that they have it, and they you know, report it to grandma, grandpa, mom, or dad, or whatever. Do you think it's the younger generation, which I think New York State is doing a very good job for the public service type of campaign and advertising, to get the younger generation more involved and really consider this? I don't know.
Yeah, this is a push. This is really a push, and New York State's going to continue to push that messaging. I think a lot of younger people, just because it kind of opens things up for them, makes it a little easier for them with school, with work, and so forth. There is a greater uptake, but you have to remember, they were the last ones for which vaccine is available. So it's, you know what I mean? They've been active and eligible for vaccination for a much shorter duration of time. So I think that may take a little bit of time to catch up. But I agree, New York State's making a tremendous push to reach people of a younger age.
It's good to hear that Pfizer, they're on the threshold of being authorized to give children 12 and under, and then it's parental prerogative if they want their children, you know, vaccinated. But it's good, we're opening up.
Of course.
Yeah.
If I could, Mike, try to answer
So
that.
they're talking about 12 to 16 first.
12 and up.
12 to 16 is what's coming up on the horizon. You know, obviously, all of the manufacturers are going to be working towards approval for younger age groups, and it is important for children to be vaccinated. First of all, some get quite ill, but second of all, for those that don't become very ill or kind of are asymptomatic, the potential of spread to family is, you know, household spread is the most common because the exposure is so great.
If I could, on the first question, we did run the age brackets by years of 10, but we only have that data from the vaccines that we have given, not where people may have gone out of county. That information is supposed to be with the state, and Dan helped us. And I'm trying to have Warren correlate that against census data to tell you how many people fall within this age group, and therefore how many people have been given the vaccine locally, how many people statewide, giving us some kind of a total. But the census data is a little bit cumbersome to work with, so right now.
Well, I asked that question because you want to see the at-risk groups get to that herd immunity through vaccination. And if that herd immunity is 80% and we're already there, I just don't understand the big push down to the children because, quite honestly, this is an emergency use vaccine. It hasn't really gone through everything. And, you know, I just don't know why there's a big push for younger and younger kids getting this now.
Well, the overall.
We still have a pretty good part of the population not vaccinated. It's across the state. There's still at least one dose. So that is not 100% effective or close. 47% of the population across the state. So we still have a way to go.
Okay. What about the vaccines? Are they talking that you will need a booster shot as early as 3 months or 6 months after your second shot?
That is unlikely, but of all the booster, you know, information, that's all under discussion. As they're seeing, they're really tracking cases and very actively tracking cases of people who are vaccinated, tracking cases of people who have had it once and now have it a second time. So it's going to take a little bit of time, but they are amassing that data very efficiently and thoroughly.
Okay. Thank you, Kim.
Kim, I got a question.
Yep.
It's being reported today on the national news that Pfizer, as you said, is under discussion. Yep. But Pfizer looks like they're going to have to give a booster every 12 months. That was released today on national news. Again,
and that would be expectable.
Right, under discussion, but they're moving that way, Mike. That answered your question.
Yeah. I mean, it may be similar to your flu shot, which is tweaked every year. You know, it may be more similar to that.
Yep.
Kim, it's Matt. I just have a question regarding quarantine regulations. I'm hearing different counties
Yeah.
are doing different things. We have students
Yeah.
that are on school buses and classrooms that are 6 feet apart and wearing masks, but they're still being quarantined. I'm being told that some of them are 10 days, some of them are not 10 days. And when does that 10-day quarantine begin?
Well, the quarantine is from the last date of exposure, and a standard quarantine is always 10 days, although if the person becomes symptomatic, it goes to 14, and if they maintain symptoms, it can go a little bit longer, though that is certainly not always the case. A lot of people who are quarantined, certainly the majority, are not symptomatic, but it would be at least 10 days from the date of exposure because you need time for the illness to emerge, and that's what you're concerned about. And people need to monitor their symptoms for 14. But we've gone from quarantining, let's say, a classroom to quarantining people within 6 feet. And the masking, I understand that being conscientious with a mask is truly important, and it could make the difference between becoming ill and not becoming ill. But masking generally in the public is not a science. It isn't like these are people wearing fitted N95s and face shields. People are wearing their masks, and therefore it is still the recommendation that students within that 6 feet are quarantined. And it's a case by case. Was their mask off for eating? Were they there for a very long amount of time? Were they singing? Was it gym class? You know, it's a bit of a case by case. But we have reduced the number of quarantine because the general recommendation has gone from quarantining everybody within the space to looking at proximate distance, which is now 6 feet.
Okay, so each individual case is specific to the circumstances.
Yes, I mean, there are definitely general guidelines that we follow, and we follow them from the state, and they are very much in touch with us on a daily basis. But that being said, we do look at the circumstance of what is going on. As I said, mask off, that's important. You know, doing gym, so a lot of ventilating, and also playing an instrument or singing, all those things come into it, and the duration of time together, that comes into it too. So yeah, we look at each one, and the schools they've had a lot of experience by now, so they really work with us. They've been great.
And what about on a bus?
On a bus, it's proximate distance, and also, it was at a time, especially in the wintertime, it's all closed up. The whole bus could get quarantined. And now it depends on the circumstance, but certainly children within that proximate distance, and they should be masked on a bus, they would be quarantined. But we do look at each case, and, if the school contacts us and said, please look at this, or whatever the circumstance is, we talk about it and we discuss it and we work with them very closely.
Okay, thank you.
Thank you.
Anybody else have anything for Kim? Thank you so much, Kim. I appreciate it.
Oh, thank you.
Okay, we have with us this evening Jason Frankfurt. He's the Director of Community Services. Jason, you want to talk to your department?
Hi, everyone. Thank you for having me. Patty and Matt came out a few weeks ago to the clinic and met with me and was telling them about what's happening in the clinic, and they asked me to present here and give some updates. So a number of things that I'm excited about that are happening that I wanted to share with everyone. As you might remember, I love talking about what we do. I'm very proud of the services that we provide at the clinic. I'm very proud of my staff. So I love being able to share about that. So thanks for this opportunity. So as we all know, over the last year with COVID, it's been a challenging year. It's been a different year for all of us, for sure. while the clinic has seen a decrease in the number of clients that we've seen, the number of clients coming through the door, I should say, by about 3,000 people, we've actually increased the number of services we actually provided by roughly about 3,000 services. So what that means is that our clients are, even through the pandemic, remained very engaged in services, and our staff kept them engaged, even despite the difficult circumstances that the pandemic presented. As all of you know, on March 17th, we flipped the switch and switched to working remotely pretty much overnight. That sounds easy. It was actually a gargantuan effort to do that. And it was tough for our clients, it was tough for our staff, but we were able to persevere through it. The staff, the management staff of the clinic was just amazing at making this happen. And that was really key. And the staff all adapted, as did our clients, and we made it through. We were able to reach people through telephone and video sessions. We were also able to add, state opened up the opportunity for us now to add telehealth to our permanent license. So we have the ability to do that permanently going forward. That doesn't mean yet that insurances will pay for that. That remains to be seen, but we do have the ability to continue that in the future. We attempted to return to the clinic back in the fall. We had to do it in kind of a stepwise fashion. When the COVID numbers went up, we went back to working remotely. We're currently phasing in, returning back to the clinic. We are providing services on site 5 days a week during our regular hours, but our staff is rotating through, and we have to limit the number of clients coming through. That's because the New York State Office of Mental Health that licenses us is still encouraging that as many services as possible be done remotely through telehealth. And we also run into some issues, just the physical space in our building. It's hard for us to manage the full flow of clients we normally would have while maintaining social distancing. And then the other issue that we've run into is just some IT limitations with the computer and the internet. We don't have enough we have enough bandwidth to do about 4 or 5 simultaneous video sessions or video meetings at a time. All of our staff were in the building, and they were doing more than those meetings, more than that number of meetings or videos. We would run into trouble being able to maintain that with our current system. We are looking to expand that. We expanded as much as we could, but now it requires some infrastructure and hardware changes. So we're looking into that. But in the meantime, our services are going full speed ahead at this point. For our children's services, most of you know we have contracts with 4 school districts, and many of our children's therapists are embedded in the schools. And that means they're not just there doing therapy with the clients, with the students, but they're actually attending meetings, relate to the students. They are completely embedded with the school staff itself, which really provides for a very comprehensive and really solid treatment approach to work with these kids and to reach these kids that are in the schools. So that was a challenge through the pandemic, because as you know, different schools handled it differently. Some were remote, some were hybrid. We adapted through all of that, and we persisted. We were able to continue to maintain all the meetings that the staff typically attends. So we were able to keep up with all of the contractual obligations we have and still reach all of these kids in different ways. I had to get a little creative at times, but it's something that still persisted. And we saw an increase in children's services too in 2020. We did about 7,000 services, whereas in 2019 we did about 5,500 services. So we saw an increase even during the pandemic with children's services as well. For adult services, we also saw a little bit of an increase. In 2019, we provided about 12,000 services, and in 2020, even through the pandemic, we provided about 13,000 services to adults. The other thing that's exciting is that even through the pandemic, through working remotely, we were actually able to expand some of the services that we offer at the clinic. And before I talk about them, I need to put them in context of what we expanded. So I just want to talk for a minute about the opiate epidemic. It's important that everyone understands this in context. You've all heard about the opiate epidemic. you've all, you know that this is a problem across the US, you know it's a problem in Greene County. But I need to explain the complexity of this problem if I can. First, it's important to understand that in 2017, the US Department of Health and Human Services declared this as a public health emergency. So it's something that's very severe, okay? Most people, when they think of the opiate epidemic, they picture someone who is addicted to heroin. I think most times the mental image they get might be someone living in the street shooting up heroin. That might be some of the people that are affected by this, but it's much broader and much more complex. People that are being affected by this are not only heroin users, they're also people that are being prescribed, legitimately prescribed drugs, opiate painkillers, people that are obtaining prescription drugs legally and illegally. And it's also, we're also seeing other drugs contaminated or laced with certain opiates that are also causing a very deadly problem. So one of the things that's important to understand is that most of these opiate use disorders are starting by people that are prescribed opiate-based painkillers. Maybe they have surgery, there's some sort of problem, they're prescribed these medicines. A dependence is developed on these medicines, okay? So many times when those medicines have to stop, whether they run out of the prescription, whether the doctor stops it, whether the doctor sees that the person is dependent, and even with the best of intentions decides to stop the medicine. The dependence is so strong that people are beginning to look for these medicines elsewhere. Whether it's prescribed medicine that they're finding illegally, or they're actually turning to heroin itself. One of the difficulties in Greene County is that when we look at prescribing practices, the prescribing practices of opiate painkillers in Greene County has not changed or decreased since the opiate epidemic started several years ago. It has remained the same. That is not common for most counties. It's not common for most areas. Most places, as the opiate epidemic became more and more, people became more and more aware of it, opiate-based painkillers began to decrease the prescription. But it's not. It's maintained the same in Greene County. The other problem is that the bulk of those opiate-based painkillers that are being prescribed by doctors in Greene County are being prescribed to people ages 55 and over. That's causing certainly an older population to become dependent on these medicines, but it also brings other risks. It brings risks of, if you think of an older population, it brings risks of catastrophic falls, depression, suicide, heart disease, all kinds of other risks it brings. The other thing is that when opiate-based painkillers are prescribed in conjunction with another class of medicine called benzodiazepines, which is prescribed frequently to the older population, the rate of suicidal ideation for an elderly population goes from 2% to 25%. So it's causing this ripple effect, and it has a significant impact on people much broader than just the young heroin abuser that most people picture when they hear about the opiate problem. So I want to give a very unfortunate example to drive this point home, and this is a very current example, unfortunately. This morning we learned that in the past 2 weeks, there were 10 overdoses in Greene County. 2 of them were fatal. All of those overdoses occurred because the person was taking a fake OxyContin pill that was laced with fentanyl, which is an extremely potent synthetic opiate. So, what most of you probably don't know is that any one of us right now could go on eBay and for about $80 buy a pill press that can press any type of baby powder type substance into a pill that looks identical to pills you get from the pharmacy. What drug dealers do is they mix in fentanyl into this baby powder type process because fentanyl is very cheap and it's extremely powerful. So they can mix in a little bit of it and it can go a long way. Problem is people are mixing this wherever, in their kitchen or wherever. And one pill might have no fentanyl in it, and the next one might have a few grains of fentanyl. Fentanyl is so strong that a few grains can be a lethal dose. So these 10 people that overdosed in the last 2 weeks may very well have been someone like any of us know, a fully functioning member of our community that maybe ran out of their medicines from their doctor, but knew where to get another oxycodone. And they bought one that was fake, that looked identical to the one their doctor prescribed. And they took it and they died. So it's a very complex, it's a very complex problem. So one of the ways that the clinic, the Greene County Mental Health, has worked to help address this is that one of these services we've started to expand is what's called medication assisted treatment. So this is, we have now a nurse practitioner at the clinic and our medical director are trained, although right now only our nurse practitioner is prescribing, but she prescribes medicine called buprenorphine, which is a medicine that also is prescribed at Greene County Family Planning as well. It's a medicine that helps people stay off of opiates. It reduces withdrawal effects, it reduces cravings, and it's been shown to be extremely helpful at keeping people off of using opiates. Greene County Family Planning has been prescribing this for a while, and this was something that that we felt would be important for us to begin to prescribe as well. So we started to prescribe that a few months ago. We've also added a social worker to our team that works specifically with the clients that are receiving that medicine. And that social worker is also now a liaison to Greene County Family Planning. So we've formed a collaborative relationship with them because many times they see people there that need mental health services. We see people at our clinic that need family planning services. So I think beginning next week, that social worker will be working here at Greene County Family Planning 1 day a week. And our prescriber will also be there 1 day per week. And that's one of the ways that we're helping to create a more collaborative relationship and catch more people and try to get more people into treatment to help address this issue.
Is that compound addictive?
It can be, I don't believe it's addictive. It can be abused. It can be abused, but the research still shows that the benefits of it far outweigh risks. And it's sort of the standard right now for addressing addiction. The other thing that we were doing at the clinic as well is that the Office of Mental Health, who licensed us, has had us become what's called an opioid overdose prevention provider, which is also a certification that family planning has also had for a few years. And what that allows us to do is it allows us to train people in the use of naloxone, which is also called Narcan. This is a medicine that is, it works essentially as an antidote to a overdose. If someone is having an overdose of an opiate, they can be administered this Narcan, which is done through a nasal spray, and it can reduce the overdose. So it's a life-saving medicine. It needs to be used within a few minutes of the overdose happening, but it's something that is extremely effective in saving lives and keeping people alive at this point. So we are able to train people to become trainers, to train other folks how to use Narcan. We can also distribute Narcan. One of the things we're doing is that we are starting to screen all of our clients that come to the clinic to see if they use opiates in any way, whether they're prescribed an opiate by their doctor, whether they're using an illegal opiate. And then those folks will be prescribed or given Narcan and trained how to use it, provided education on as well. We can also give it to someone say we have someone who's a patient at the clinic who might not use opiates, but maybe they have a son who is addicted to opiates, or maybe they have a husband who just had back surgery and is taking opiates and has chronic back pain. We can give Narcan to them as well, so that they can have it on hand. It's extremely effective in saving lives. So these are services that we did not provide previously that we have expanded into over this past year to help address this.
Jason, have you found with the Narcan or giving it out so freely? I mean, I've heard instances of people who will, they have the Narcan, so they will purposely give themselves like the biggest high they can, and then Narcan themselves come out of it. Like it's, do you find that the Narcan is being abused by giving it out so freely?
No, for a couple of reasons. First of all, when an overdose like that happens, it happens so quickly, you can't self-administer. It has to be someone else that gives it. So, and the other thing is that when Narcan is administered, it is an extremely unpleasant experience because it throws the person into immediate withdrawal. And it's not something that we are hearing reports of being used. The other thing is that Narcan is also completely safe. You know, any of us could take it right now and it wouldn't affect any of us in a negative way. But if we had an opiate in our system, it would essentially deactivate the opiate. So it's a pretty safe medicine. And there are also laws now that changed to help encourage the distribution of it as well. One of the other things related to the opioid epidemic is that, you know, we have this, you may remember, I don't know if we've talked about it in a while, but there's this, it's called the Healing Community Study, which is a very large study. It's a federal study from the National Institutes for Health and National Institutes for Drug Abuse. And this was a study that came to Greene County, I don't know, a couple of years ago, and I presented on it a little bit, but I didn't know much about it. We didn't know how it was going to take shape, but now it's really taken shape. And it's had some really great impact in the community so far. So what this is doing, what the this study is occurring in 4 states. As I said, it's a federal study. It's occurring in 4 states. It's occurring in New York, Massachusetts, Ohio, and Kentucky. In New York, there were 16 counties chosen to participate in this study. Greene County was one of them. While it's helping to bring some good things to the county, it's not, it doesn't, part of the reason we were chosen is because of our high overdose per capita rate in the county. So that's one of the reasons. The goal of the study is to reduce opioid-related overdose deaths by 40% over 3 years. Okay, so that's the goal in each of the states. And the way they're doing that is that there are 4 strategies that they identify that are supported by the research to do that. One is to increase access and availability to medication-assisted treatment, as I described, the buprenorphine that we're beginning to prescribe at the clinic, that family planning prescribes, and that they prescribe at Twin County Recovery Services. Increasing access to that, whether it's referrals or service itself, that's one of the strategies. The other strategy is to increase access and awareness and education around naloxone, Narcan, as I described. The third practice is to increase safer prescribing. As I said, we have this real problem in this county for whatever reason, where we're prescribing many more opiates than what should be prescribed and what's happening in most other counties. So there's a campaign to help address that. And then finally, there's the 4th strategy is around communications, and that's to create media campaigns and educational campaigns, do whatever we can to get the word out, to educate people about this problem, about these services, all of this. So the Healing Community Study has done some great things with this. It's also brought together this really, you know, we're trying to create this kind of unbreakable net of service providers, you know. So we're working with the Sheriff's Department, we're working with DSS, we're working with family planning, Mental Health Association, there's this whole web of people that are really working together around this common problem. So we're trying to hit it from different angles, and I'm very hopeful. You know, it's a dire problem, but I'm eager to see where we are in a few years as well.
In part three, you stated earlier that the number of prescribed opiates has not been reduced. So how is the state or this particular grade going to deal with that?
Well, there is they've created a work group now. It's called Safer Prescribing Work Group, and we meet regularly to discuss how can we address that, you know. And I believe one of the things that's coming up is a series of webinars for prescribers to help educate them and to work on this. We haven't come up with other strategies yet. You know, there's still some time left in the study, but changing practices is a difficult thing.
So they take no responsibility for the situation?
Well, I mean, we haven't addressed it with them, you know, directly yet, you know, but it is a real problem. It is something that has to be addressed. You know, it's a delicate thing. It's I can tell you just in general, trying to tell any healthcare provider, you know, that you should be providing services differently. It's not an easy discussion to have.
Bill, I'll flip that on you, and I think what will happen is the insurance companies will limit, you know, rather than giving a 90-day supply, you know, maybe they'll only approve 14-day supply, and then you have to go back to your primary physician in order to get that renewed again. I think the industry, from a cost perspective, but I think many times what will happen is, had surgery, you get a 90-day script. After 4 or 5 days, you're feeling good, and you stop taking it, but you still got this in your medicine cabinet. So I think the industry itself will also, I don't want to say self-police, but the issues that Jason had brought up in terms of why are we prescribing so much, I think it's been a revelation in the data collection.
Well, I have no problem with the prescription given to a person for the use of painkillers. It's the fact that the doctors never seem to stop that particular line of treatment until it's too late. Then it becomes our problem because they've got to go to some sort of mental, or they get Narcan or some other thing. I think the doctor should be fully involved in this situation. I'm surprised that they're not.
Well, I think it's one of the goals. It's one of the things.
Where's your AMA on that type of an issue?
Exactly. I mean, because buying them illegally, they still have been prescribed to somebody. Sometime.
Yeah. Joe Sanzioni?
Yeah, we have the drug awareness, Greene Drug Awareness Coalition, I believe.
You speak up, Joe.
Okay, Drug Awareness Coalition, Greene, they have an organization. I understand, Jason, you may be
I'm one of the co-chairs.
one of the co-chairs, okay. Now, isn't that organization comprised of doctors that have been working on this issue as well?
Yeah, I think that's what it grew out of as well, was looking specifically at opiates, and now it's actually broadened to look at all addictions. But yeah, that is a great organization as well, where we meet and we try to include a whole range of people from the community involved in that, whether it's physicians, pharmacists, treatment providers, community members.
So are they making progress in that respect at this point?
They are working closely with this healing community study right now as well, because the Columbia Greene Addiction Coalition had a media campaign and that we were working on, and the healing community study also came in with some funding for a media campaign as well. So, we were working on that. So we've kind of joined forces with that. And I do agree that, getting actual physicians involved is something that's important. It's sometimes challenging to do, but I do believe it's something that's important.
What was that called? Columbia Greene Addiction Coalition?
Yep. Great website for it.
Jason, regarding that Narcan, I'm certified to first aid and administer Narcan, Isn't I was trained that, if you're fortunate enough to revive the individual, stand back, because they're in a perfect high, and they're going to come out and very possible to be violent, right? It is a great savior to save a life, right? And the problem is when the vial, the thing is expired, My position, you know, New York State, we have to return that because you don't want somebody to give it to somebody, even if it's expired, that, hey, you got a freebie, you know? It's very difficult what you're doing. It's very complicated, you know? And unfortunately, you know, pharmaceutical companies, of course, they're involved, whatever, you know what I'm saying? You know.
Yes.
Are you involved in any of the drug, like 2 weeks ago, we had at Carroll Police Department, we had a drug collection at CVS. We had 12, they collected 12 cases, 175 pounds of medications. You're not
Sheriff's
involved?
Department has done that.
The sheriff does it, Carroll PD, the DARE program, in Carroll. Do you, I mean, obviously you don't know what was collected, right? I don't know if there's ever an inventory was collected.
We do not.
We do not. So we don't know if we're getting opioids or if we're getting Tylenol off the shelf, right? Or, you know, any other prescription. But anyway, they collected 12 boxes, 175 pounds, which was a lot. I hope that some of that was opioids that were given back, right, you know, for destroying.
Jason, something else that you mentioned, which I thought was important, we meant to do that, you know, a lot of these schools contract with your department and Questar. I don't know if you want to share that with everybody.
It was in my notes. I didn't put it in my notes.
It's like, I'm not done yet.
Yeah, so as you know, the schools contract with us, and part of the reason they contract with us is because we do provide these other services that we can't bill insurance for. Participate in meetings, we consult with them, we do all kinds of other stuff. So for years, the schools have been asking if they could, they have a special line of funding through Questar BOCES that they can use for certain things, and they've been asking, can they use that for part of their contract fee with us? And for whatever reason, there were roadblocks to that in the past. I'm not before my time, but it took a fair amount of work over the last year. But as of finally today, I got a final phone call. I think there's a contract like about to be approved and sent to our county attorney's office where Questar BOCES will now be helping the schools. They're going to be paying about 30% of the school's contracted fee so it doesn't benefit mental health at all financially, but it benefits the schools, and we were excited to be able to do that for the schools to kind of help them out a little bit. And you know, the school program has been really well received. It's expanded over the years. We keep having schools come to us and ask to add more therapists in their schools, or we've had more schools come to us, and it kind of continues to go in that direction. So, so this is something that I was excited to see come to fruition. It had to happen now. The schools out. Anything else?
Just going back to the 10 overdoses that you talked about earlier, were they all treated with Narcan?
You know, I don't know that right hand. I know where I can get that data, but I don't know that offhand. I do know that eight of them survived. 2 of them were fatal, but I don't know if it was Narcan that involved.
Because the grant you just mentioned is to reduce the number of overdose deaths, correct?
Yes.
So is that, I mean, it's not going to reduce the number of overdoses necessarily.
We'd like to, I mean, that's sort of our goal.
I
The
know.
study is looking at the deaths, but our goal is all.
So do you know the number of deaths, overdose deaths to date that we're dealing with?
Again,
Laura?
if I was in front of my computer, I could tell you that, but I don't know. I don't know if Laura knows.
Laura, do you know that?
I don't have that number.
I can get it.
We'll get it, yeah. Sure. Thank you. Thank you.
Thank you.
Excuse me. Hello, can anybody hear me?
Yes, Mike.
I was hoping to ask Mr. Friedenberg some questions.
Sure.
Are you there, sir?
I am.
Oh, okay. Yes, sir. Mike Ryan from the Mountain Eagle, in case you don't know. I apologize to the legislature for taking up your time, but I haven't been able to get through to Mr. Friedenberg. Mr. Friedenberg, have you received my phone messages and email?
I did 2 weeks ago, yes.
You did that, but okay. So if you don't want to talk to me or can't, that's fine, but just so as long as I know. Anyway, Mr. Friedenberg and the legislature, the reason I'm here is because a press release was issued in late March by the Mountaintop Cares Coalition saying a drug recovery center was opening in Windham. And the county and Mr. Friedenberg are an integral part of that press release. So I heard your presentation tonight, and it's very touching. Yeah, it's a very, very serious situation. And you've given some of the details about the grant money and stuff. Now, so county mental health, there's this center in Wyndham. There's going to be a center opening in Wyndham. And the reason I was trying to contact you, sir, was to ask you questions that people in Wyndham are asking me. And I don't intend to conduct an interview here with you tonight. I'm hoping we can be in touch. There is some support for this project in Wyndham, but in a nutshell, many people and officials are wanting to know how, when, why, and by whom the decision was made to place this center in Wyndham, and why Wyndham found out about it only after it was supposedly a done deal. So that's kind of the direction I want to go in. Have you been to the site in Wyndham to see where it is?
I think the answer to your question, those questions are really for Mountaintop Cares. That's not my purview to answer those questions.
Well, the reason I'm asking you is because I can't get through the Mountaintop Cares Coalition either. And you were very much a part of this press release that was issued by Mountaintop Cares Coalition. So that's why I reached out to you, and I was advised to do that. So, you know, Wyndham wants facts, and some people may think I'm the wrong guy to go to for that job, but information has been difficult or piecemeal. So that's why I reached out to somebody, because I'm understanding there are issues about liabilities for the county and the town. And the question I wanted to ask you was, are you aware of the controversy and the legal challenges that unfolded in Wyndham last summer when the coalition announced a drug recovery center was opening?
I've heard that there has been controversy.
Say that again, sir?
I have heard that there has been some controversy.
Well, there was quite a lot of controversy. And are you aware that the coalition has not been to the local planning board for a site plan and community impact review? And they've already announced this as opening.
My understanding is that they were due, I think, this week.
Yeah, but they announced this 2 months ago. So in any event, again, I don't want to waste the legislature's time here, but it seems as though what the impression is that 3 people made the decision to put this center in Wyndham. And it may be one of the most worthy causes there is. But the press release had Mr. Jonathan Gross, who's the executive director for Mountaintop Cares, Maggie Graham, who is the former head of community services and now a coalition board member, and yourself. There was no one from the town of Wyndham or any of the towns and villages supposedly being serviced by this center. And at least I saw none in the press release. So what I've done, and again, I've submitted a list of questions to Patty Handel that I was hoping to get to you. And if you're not the person to answer them, then I would like somebody to put me in touch with the person or agency who will answer them, because the town of Wyndham has a lot of questions about this and they're not being answered. So hopefully we can get that done. And I appreciate the legislature's time tonight, and hopefully we can speak, Mr. Friedenberg or whoever, and get answers to all these questions the town of Wyndham has.
All right,
Thanks,
Mike.
Mike.
Thank you.
Thanks.
Thank you very much. Good night. Okay, we're going to get to our resolutions here. First item, amending resolution number 239-19, authorizing contract Greene County with Greene County Emergency Medical Systems, Inc. I do think we should pull this resolution this evening, and so we can, I think it kind of ties in with everything going on with Catskill, and I kind of feel that we need to come to a resolution with everything else has to do with this. I think we do need to do a workshop. Yeah, I think we need to get more answers from maybe Ray Ward.
What
Not Ray
what
Ward.
we're doing with mutual aid as well.
Mutual aid.
Sean Hoteling, perhaps.
Oh, okay, that's a whole different, yeah, that's.
Right, because this
I think it
involves-
ties in with each other. You know, I don't think this is just one resolution separate from itself. I think they both tie into each other, and until we can have another discussion and a workshop on what we're going to do with council. I don't see where we can vote on this and.
We do have an upcoming workshop. We have that scheduled. Yeah, I had a general workshop scheduled, so I could put it on that, but in the meantime, having Sean Hotel come in, I'd rather give him either the questions or how do you want him to report out rather than hitting them that night cold. I'd rather have some pre-work done. So if there's something that Sean has to be working on to formulate a program, but let's get him moving on that so he can give some kind of a status report at the session itself. And then this is an unrelated issue, but they tie it back into the supervisor's presentation we had 2 months ago. And so we can all look at that.
I don't feel.
My only caution to you, workshops do not make decisions, they're presentations only, and after that, you make.
Don't think we're ready to really vote on this resolution.
Then I have our as chairperson, are you tabling this or I don't know if we need a motion.
She can pull it up.
Okay.
Like I said, pull up.
If Patty, if we're going to do a workshop on this, then we definitely need to have the questions ready ahead of time, know what we're looking for, what kind of information you need. As far as I'm concerned, this resolution here, Catskill's able to back bill the insurance companies for this mutual aid fee. They can bill for their service that they're not providing. So I'm not sure that it has anything to do with this resolution, but it is part of a larger issue. I would agree with that.
Right. So, yeah, I can definitely come up with a list of questions and the other members of the committee will come up with a list of questions.
So who are we going to send those questions to? Pat, who do you have in mind?
I was going to send to Sean and let him.
Yeah,
Have some
as the
observation
EMS
there, too.
coordinator, Mr. Hotel.
Well, he's talking about the mutual aid. Also, the other concept that was brought up by the Catskill legislators about the rebate or the change in the ambulance district. There was a couple of ideas that were floated around. Are they all included in this workshop?
I think that has to be part of the discussion.
As their individual topic, perhaps with an overarching issue. And they are somewhat independent, but there is, as Pat just mentioned, there is an overarching theme here, or the issue of ambulatory services in the county in general.
Yeah, well, all right, so any questions related to that would be okay to send them to you?
Send them directly to Sean Hotel or send them to me, I'll forward them either way.
I don't want to overburden Sean with stuff he's not familiar with. And,
if you send them to me, then I'm gonna corral who I gotta corral.
all right.
Okay, thank you. So second resolution, authorizing agreement, Greene County Mental Health with State University of New York, Delhi. Rivera Davis, all in favor?
Aye.
That's carried. Budget amendment, Greene County Public Health, New York State Foundation's branch funds. Davis. Rivera, all in favor?
Aye.
That is carried. Is there anything else to come before Health Committee this evening?
Yeah, I want to bring up something real quick. I was reading about the Climate and Community Investment Act. I'm bringing this up in health services because one of the biggest uses of our cars is for healthcare. This bill, if it's passed through the Senate, will raise gas 55 cents a gallon by putting an additional tax on it. I called Senator Hinchy's office to make sure she doesn't vote for it, and to my surprise, not only is she going to vote for it, she's a co-sponsor. So I think everybody needs to reach out to Michelle Hinchy's office and tell her she's there to help Greene County, not to hurt us. Last year my family drove 1,250 miles for medical services. That was a light year because of COVID. Usually it's over 2,000 miles a year. That's gonna hurt us. Thank you.
What was that?
Is there a bill number there?
No, I don't have the bill number. It's called the Climate and Community Investment Act. And I'm hoping NICEAC is gonna have a resolution for that, against that, for our government obstacle.
I will check with NICEAC in the morning.
Get that on government office.
Thank you, Greg. Is there anything else to come before Health Committee this evening?
Motion to close.
Motion to close.
Second, you didn't even lose control.
Second, here.
Almost.
It was so close,
It was
so close, I teetered.
Like Ryan
Sorry.
threw a monkey wrench.
Phew.
Mike's got a chance to redeem himself.
Roll my tongue up.
Action.
Okay, I'd like to bring county resources to order at 6:58. We have no agenda items today, but a couple things. I spoke with our college president. All the construction projects that were on the table are complete. They did have funds left over, and they're using some of those funds, not all of them, but some of those funds to rehab the gymnasium and the bleachers, which are, I believe, original. So they're doing that. On the other end, on the academic end, the resolution in health services with SUNY Delhi is a component with Columbia Greene Community College. They're going to be able to offer students be able to take Bachelor of Science degree credit classes for 4 years at the campus in Hudson here, in Greenport. And most likely they will have a office at the college with a representative from Delhi that will be there to assist the students as they move forward, get their 4-year degree. Just nursing is just one of them. But they're pretty excited about that. They should be very excited about it. They also are ready to announce a partnership with Olana, which will, they will work together with Olana, Frederick Church Olana, and to bring art classes, and it'll almost be like a internship that they'll be working with Olana for these art students, take the classes there, and then also work there through an internship with Olana. So they're pretty excited about that because they are neighbors. Their lands adjoin our land. The college campus adjoins Olana. So they're excited about that. Their online applications for admissions is up and running and full bore, and it's been a godsend, she said. It's really making things easy for the students that want to come to that college. And I know I'm going to forget one other thing. We've got those classes. We'll be starting in September, the micro credential classes in Cairo.
Chamber of Commerce, Town of Cairo, and the Cairo Library Coordination.
Right.
Bringing those classes to Cairo in the fall, which is a great thing.
Right. So just a few of the things happening at the college. They are going to be receiving some of the federal stimulus money. They don't have a number nailed down as to what they will be receiving, as many in other municipalities and schools don't really have the number nailed down yet. But she said when she gets that, she will obviously forward us, because they will be going to budget in the future.
They're in the middle of the budget right now, absolutely. Yeah.
So one other item now, not relating to college, for our public hearing on the youth 12 and 13-year-olds to be able to hunt with assistance and with guidance from an adult. We will have a member of our Greene County Sportsman's Federation there at the public hearing to answer any questions and to give their take on it. So I'm just glad to hear that someone stepped up for that. And I don't have anything else for county resources. Does anybody else?
Mike, did the college president mention anything about their partnership with Toyota now?
Yes, Toyota and Subaru. Toyota's confirmed. That is for the electric cars. So they're putting a new program in. They've had a program with Toyota for years. And now this is, they've had a car donated to them from a Kinderhook Toyota electric car, a Prius. Students will be able to begin working on. So they're developing a program there for the electrical side of things, and they're looking for Subaru to do the same thing. And they're gung ho with that. That's moving forward.
And you talked, Mike, on, remember we talked a couple, probably over the last 5 years about the electrical training program in the college. Any talk on that?
That has not moved forward. No, not there.
Is there any future talk, perhaps that
We
moving forward?
should keep bringing things up like that.
Is that a SUNY decision or a community college decision?
There's a couple of community colleges that have a training program. Basically what it is, it's electrical lineman program. It, trains our, our
Yeah, no, I know what the
Greene
program is, but they have
utilities.
to apply to SUNY for the approval for the curriculum.
Right.
And I don't know if they've done that and it's turned down or not.
I don't know if they've done it. We talked about it over the last 5 years. I know that, like myself and others. Maybe you could check on that again.
I will, absolutely.
They're good paying jobs, and it's, a lot of youth in Greene County would like to get in that field. And if we could train them right here and keep them here, that's what we want. Sure.
We brought it up with them last year, as part of the discussion on this plan or where they're going, the curriculum and programs in the future. They said they would look into it.
They'll look into that program? Yeah, good. Excellent. Thank you.
Thanks, Mike.
Sure. With that, I entertain a motion to close. Motion. Second, Rivera, and seconded Dorrington. We are closed.
All right, guys, I gotta run. I will see you all next week.
Safe trip home. Good night.
She's getting married.
No, she's Franklin.
Huh? Oh.
Ready? Call Public Safety Committee meeting to order in the absence of Mr. Hobart. I'll chair the meeting tonight. First thing on the agenda is the jail update.
Sheriff can start.
Have something.
I'll start with my regular report. Part of it does include the jail, though. Most of it does, actually. This month, we served 165 civil papers. I'm sorry, civil attempts were 165. We served 83. We issued 38 traffic tickets, investigated 16 accidents, made 16 arrests, and 2 DWI arrests. In addition, we handled 426 calls for service and made 126 traffic stops. Jail transition team is continuing to work on emergency plans, move day schedules, key ring placement, and distribution. They've also been working on punch list items and system startup training, including the HVAC system, kitchen equipment, and the fire suppression system. On April 1st, the starting jail population was 38. As of April 30th, it was 40. Corrections officers did 58 transports last month, traveling 4,371 miles, totaling 166 hours, moving 44 inmates. There were 13 state-ready inmates awaiting transport to night stocks. 10 were scheduled to go today, is the day tomorrow morning. April 21st, the administration of the Sheriff's Office moved into the facility, and we're continuing to work with the on-site vendors on the finishing touches. We are technically still on target to move our inmates back on July 1st. Is that correct?
Don't jinx me.
Corrections officers are still providing enhanced security at the Sheriff's Complex and have begun to do a shakedown in the building for potential conflict. The team is also in the process of changing policies to comply with the changes to the minimum standards for special housing units. If you don't know it, that came out as part of the budget, with the budget, called the HALT Act. It limits the amount of time we can segregate inmates. I think the policy's changing, correct, Superintendent?
It's too bad because we don't have a designated special housing unit. So anything in our policies that had state special housing, so we remove that from our policy.
We do have some issues with Stanley Security, which one was a part of today. Basically on the jail doors and the camera systems. Stanley had to rework 36 doors that were wired incorrectly and did not operate properly. We're also waiting on their software technicians to return to the site and complete the setup of cameras and door controls. So we were going to apply for permission from the COC to do our intakes at the new intake portion of the facility. However, we cannot do that until the Stanley system is functioning properly and everybody's been trained on it. So that may have to wait till we open. Let's see. On another note, the federal moratorium on residential evictions has been extended until August 31st. I believe there's also a bill in the state to do the same dates. We're still coordinating with the Catterskill Cove Working Group regarding potential parking enforcement and staffing problems on the Route 23A corridor from Gallenbrook to Haines Falls. This is the first month in over a year that we've had no cause complaints.
There is a light.
A light at the end. All right. One other thing I wanted to bring up quickly is that we're investigating purchasing a body scanner, basically a large X-ray machine for the jail. It was an unplanned thing, but we are now prohibited from strip frisking inmates without probable cause. But we are permitted to scan everybody that enters that facility. So therefore, we would be able to detect items that they may have secreted prior to coming. Just last week, we had an inmate that we processed and we transported to Ulster County. They scanned him through their scanner and found a quantity of drugs within him. Balloon that we would have never found.
Yeah.
So just one of those bursting or those getting through and being handed out, somebody overdosing with one of those incidents would cost us a lot more in a lawsuit than it actually would have cost us, Go ahead tonight. Jason talked
I
about
would like
the
to,
overdoses.
I would like to just, for the record, enter my thoughts from something I've heard, that Michael Overbought, I'm not his mother.
or Andrew Overbought.
I've read that somewhere.
Yes. I love Michael dearly, but I'm not his mother.
Tabby, please let the record show for clarification.
You did change his diaper, right?
I could have been his mother.
Sheriff, the malfunction of the doors, is that going to be a change order?
No, absolutely not.
No, I'll expand upon that. The sheriff was rather diplomatic in his explanation there. We had a Zoom meeting today, and I will admit that this meeting was probably my most uncomfortable in my 11 years, and my blood pressure probably exploded. We, as a team, berated Stanley. We think, in my personal opinion, they've been very lax in communication, and this is not the electrician's fault. The electrician puts in the diodes, so you know the door is locked, closed. But then it's the brains of the software package behind it which then light up the board that tell the CO door 25 is open or camera number 7 is not working properly. And we ripped them very uncomfortably today. They had initially started saying, well, in a week or two, we'll get a technician there. And at the end of our meeting, someone will be there tomorrow morning. would say, a very uncomfortable meeting for the representatives from Stanley. I'm anticipating more work to be done in the next 2 days than they had anticipated in the next 2 weeks. And it is small stuff, it's just, but the problem is that the training of the CEOs can't completely commence. And so, think of those dashboards, everything from inside the pod to master control. 179 cameras in this facility. The CEOs who are going to be assigned to those operations have to be able to instinctively know which camera, what number, how to zoom, how to turn, all those things, let alone the door operations. All walked, in various salient boards, one door closes behind you before the next door opens. All of those mechanics have to be down to rote before CFC will let us commence. So I'm anticipating now that after today's discussion, that training will be able to come to completion as soon as possible, which gives us the ability to get into that July cycle for bringing the inmates back.
Is the problem in the lock itself or is the computer?
Software.
Software, okay. So it's been bouncing around, some locks will work and some won't?
Correct.
Right.
Remove it, something like that.
Right, and some don't work on the computer screen, which is swipe.
Okay.
Yeah. Some are supposed to not open when others open.
So, and getting back to the scanner, think of yourself going to the airport, you go to the airport, you have to do one of these. It was not something that we anticipated in the design, but we certainly can accommodate it physically. It will fall within the FF&E budget of the program, but it is quite expensive. So my discussion with the sheriff is let's make sure the other FF&E items are complete, that we're not going to sacrifice something else that really is a day-to-day item that's necessary. And if we can fit it within the FF&E, for those of you who haven't seen the picture, if you want to come to my office after the meeting to see the picture, when he says that our transition team never would have found this even with a strip search, they wouldn't have. But when you see the ingestion of what appears to be very simply a large balloon, that would have been discharged in a facility, and then someone's either taking their own drugs or selling their own drugs. And now with the change in the ability to conduct strip searches without probable cause, who knows what could happen. So I was a little bit bullish on the price tag, but after this event and understanding litigation, this might be something we want a serious look at. We do have to check maybe some other vendors, maybe there's a different unit that can accomplish the same thing, but this is pretty big. But again, we're under budget. We still have room within the FF&E allocation, even for this piece of equipment. I just want to make sure that we've got, every desk and every piece of normal computer equipment before we commit.
Would it be only for prisoners or for everybody?
I'm sorry?
Only for prisoners or for everybody?
It's for prisoners, basically. We could use it for other police-related things.
Legislators.
Can we use it for visitors?
The visitors are processed in a different way. There's a magnetometer and a package scanner, and then the inmates are searched prior to going back into population. So rather than to be intrusive upon the visitor to the extent that it's for us.
That makes sense.
Are you going to share that dollar number with us? Or
Yeah.
going to keep
On
it
this
under
evening,
your hat?
in round numbers, it's $140,000.
No wonder why you weren't telling us. Like, and that number is.
Yeah,
Yeah, it's big, but
the other thing is bail reform. So not many people are actually going straight to jail from the arrest. So when they are going, they've got time to plan. Now they get sentenced, they know they're going, they know when they're going, and they have time to prepare and secrete these items more so than before. So,
On the inmates that are going to go to state prison, has it been delayed or are they starting to speed things back to normal?
Mike, you want to fill in?
It started to pick back up. They were taking state readies. There was some outbreaks. They stopped taking state readies. And then slowly began to open it up again. And then like our guys were all in Ulster. Ulster had outbreaks. They wouldn't take that. So now they're There's a different screening process, so if your name comes up, you're state ready, they have to test you, you have to be accepted before you get to work through the process. Well, but it's closed down completely for I guess, 5 months.
Yeah,
maybe
3 to
more,
5 months.
And then it opened up slightly, they got shut down again because of outbreaks, but now it's, the cost is back over.
So even if they fully open, we're still stuck with them for an extra 14 days.
Yes.
Right.
At least.
And then this is statewide, so everybody's getting a little piece to take it downstate, so we got our time. We may not come around and get on the wheel for, still gonna take our next time.
In a situation like that where the state has the delay where then the county has to house that inmate past the time, does the state reimburse at all?
I believe there is a definitive number of days after which they're supposed to pay us. I'm gonna throw a dart at 30, after we've been given notification that they are to be transferred. I'll confirm that. I don't think it's ever, I'm sorry.
10.
Is it 10? Thank you, Joe. I don't ever remember getting a check for day 11, so.
I've never seen
You just never showed it.
Okay.
Sheriff, what about the windows up?
The windows, I believe, are still somewhere in customs.
I thought they were playing Florida.
There were some temporary.
Yeah, the
ones.
temporary, so for those of you who remember, the actual windows, and this is in the pod, by the exercise areas, the manufacturer failed their own QC test before release. What they eventually ended up doing is sending us just kind of a generic window that was able to be installed, which allowed us to conduct the fire air testing and the evacuation, which all passed. Now we're just waiting for the windows, the final windows to come in. And, I don't have a date, so but even that, I don't know if this window would prevent us from opening up. The problem would be when you get the new window and you have inmates in, then you got to move everybody out. You got to bring the construction crews in. Some of these windows are tall, so you're talking about ladders. But I was thankful that the temporaries could get at least placed in to conduct these fire tests, air evacuation tests.
Pete, one question, as we rapidly approach July 1st, before we know it, is there any possibility that we can have a final tour before you officially?
Yeah, I was gonna say that. Actually, I think Thursday, we have one.
Final what, I'm sorry?
Tour. We have
Oh,
one scheduled
I
for
have
Thursday.
I have department heads tomorrow, but yeah, I'm still planning on having at least one more jail committee meeting. We've traditionally done on Thursdays afternoons. But you certainly, I mean, at any time, it probably would behoove you, for those of you who have been in recently, to go in prior to the actual.
If you want to call us ahead of time, we'll make arrangements. because
Or
I
if
can't
you're
do
open
it, Mike
tomorrow,
will do it.
tomorrow at 11 a.m., I'm taking department heads to go.
Yeah, if you want to come off hours, let me know. We'll make arrangements.
And to finalize, one last part of that question, is a couple of committee people, doesn't matter, we have police, 14 pounds. A couple of people have asked me, could they be invited too? I said, I don't know. Yeah, so, I don't know.
I would say, call the sheriff's office and.
But
Yeah, then bring them down. We'll,
yeah,
as long as it's organized and we know who they are.
yeah, maybe that should be done separately. If they want to, whatever.
Yeah,
They said it was
as long as we're not up and running.
Yeah,
Once
Yeah.
once July
I prefer
1st.
to have it concluded by the time we.
Right. I get you, yeah, okay, thanks.
And I could say I toured the jail with the sheriff, and the safety and security measures that we have for the inmates and our employees are state of the art. Something we've never had in the county, so I think we should all be proud of that. And, especially you that oversaw that, but these measures are in place.
Yeah, I'm very happy with the results and the fact that we are providing state-of-the-art safety for the inmates, our COs, and the visitors.
We're certified by New York State. That was your goal? You were right?
Well, no, we completed the accreditation for the road patrol. That's done.
Okay.
The jail, we are on track to do it, but we cannot get that accreditation until We're up 6 months, I believe, in running. And then they will come and assess us in the jail. There's 4 different accreditations. And today we actually heard of the National Medical one, which is another one, which. Thank you.
Thank you, Sheriff. Okay.
Just to wrap up on that, then, so those of you who've driven by recently, the landscaping is nearing completion. The jail committee did amend the landscape outline. In essence, we determined that the original plan, for lack of a better terminology, we had too many deciduous trees. You know what happens in the fall with deciduous trees? And then the number of detention ponds on site. So we actually, I believe the number was 28 trees that we changed out and then swapped that for a slightly lower number of just evergreen trees. We didn't take out every deciduous tree, but we just took out some that was strategically located closer to the detention ponds. And that work is going good. If you've driven by recently, you drive by the berm on 9W, it's pretty impressive. That work will continue, and then the last thing will be the final asphalting and striping of the parking lots. They were in the field this week with Delaware Engineering. We always anticipated that the ring road and some of the parking lots, after the binder was put down, just due to construction vehicles, that was going to be damaged. That would have to be saw cut out and replaced, and that has now been identified, and then work will commence as well. So we're down really, we're down to some short strokes, but of course, short strokes can last forever if you let them. So we're really trying to push to finish this up, so that our July date stays intact. Next week, Lauren and I have been working now on the medical contract. We put an RFP out. Steve, really a total of 4 bids. One was, I will classify really as, I won't call it unofficial, but it did not come through the RFP process. So we received 3 bids, all from national or regional firms, all of them who do existing facilities. And yesterday we had kind of a after bid, a telephone interview. A number of questions came up, so we asked 2 of the 3 the same questions. The second interview was today. We're not going to bother with the third because his bid was so high that he or she wasn't going to be in consideration anyway. We have some other things to finish up tomorrow and Friday. I'm going to hope that we can have a special meeting, committee meeting on Monday night, and even to go as far as to say a special full board meeting to make this award, because they have to go out and hire the staff, the nurses, et cetera, for this. So I don't want to wait too long, but if worst case comes, we'll have a special public safety meeting on our Monday night, the last Monday of committees, and then the Wednesday to be able to have the full board approval. They are quite complicated in terms of the services. They are expensive. But you have to remember, we've gone from a program that was done in-house with a nurse who worked Monday through Friday, 8 to 5, and you're going now to 2 shifts, 7 days a week. So that is going to be an increase. It's something that we anticipated. We do have money in the budget for this. Even though it's going to be a large increase, I look back in a number of years that we had limited healthcare providers and the prospects of correctional officers passing meds. That was a litigation waiting to happen. Jones got Smith, or Smith got Jones, or something like that. So they take all the liability as well. So I want to get that to you in this cycle, so we can get that firm up and ready. The firm that we at the end of the day, we do have a preferred firm. They run most of the jails around us. The interesting thing that came up in our telephone conversation yesterday, some of their existing staff that is in surrounding counties live in Greene County. So they're going to do some transferring of people, so your own residents are going to end up being in the facility under contract with this firm.
So will this be a yearly contract?
All the proposals were multiple year to start. If you can envision, there's a large expense startup for them. They have to bring in a lot of equipment. So for the capitalization of that. So we're starting mid-year, you know, like July to the close at 12/31. So right now we're doing this half a year, and we're doing 3 years, and then with an option, I think it's 2 single-year options on the backside. This is a very complicated process. It's just like my normal insurance renewals. It's very complicated. You don't want to do this yearly. You want to sink this in for at least a 2, if not a 3-year period of time. And that's fairly common in the industry. But the preferred firm, I was very impressed. This is our second telephone Zoom interview with them. They're in 5 states, Warren? Yes. 5 states, and I want to say 29 facilities, and they do multiples. And so our CFC is very comfortable with it. Their protocols and procedures are already approved. So it will be a very simple transition for them to commence. That's what really knocked out the local bid. The local provider who submitted a bid, who's not in the business at all today, did not have any protocols that would have to be approved by the CFC, and it probably would take them months to put those together. And yet they weren't even a little bit anyways, at the end of the day. So I hope to bring that back to you Monday. Other than that, on the jail, as you see, most of the construction trailers are now gone. There is one, I believe the pipe trailer will come out tomorrow because the pipe staff are actually in the jail in a conference room operating now. And that will leave the prime contract with Pearson, their final trailer, and I believe that's only going to be a week or 2 before they're gone as well. So we're pretty much on schedule. We are definitely under budget, and we're ready to go. Transition team has done a wonderful job. I really have to commend, is it 4 or 5? I'm not sure if there's a 3. They have lived and breathed this facility. They've walked every inch of it. They've made some changes during construction. We moved cameras, we've added cameras because they live and breathe this. And we've done an excellent job.
Thank you.
Move on to the agenda.
Okay, moving right along. We have Joe, District Attorney. Would you like to say a few words? Sure. Okay, we're talking about a grant for discovery and bail reform. As you know, discovery and bail reform commenced January of 2020, and that created an enormous increase in the workload for district attorneys across the state of New York, especially here in Greene County. The state passed this reform, but they provided no means for the offices to meet the demands of the reform. So we've been handling the workload. Everybody's been putting in 200%. I'm really proud of my staff. Now, the District Attorneys Association of New York has been lobbying for additional funds, and that's because we know the added time, resources, and equipment that are required to meet these obligations. Unfortunately, that's fallen on deaf ears as far as the majority is concerned in Albany. So what we did here in Greene County is back in 2019, just before bail reform and discovery reform took effect, we purchased very expensive laptops that could pretty much hold our entire caseload of the office. So we could work from those laptops so that when we go to court, we can be updating our files as we are there in court. And it proved to be very beneficial to us when COVID hit, because when we were hit with COVID, we were already paperless at that point, so we could all actually fully operate remotely from home. So it did work out to our benefit. Now, we have Manhattan District Attorney Cyrus Vance, who is not seeking re-election this year. But what happened was over the years, he hit hard on the drug task force. He took in a lot of drug seizure money. And so he had several millions of dollars. So kind of out as part of his outgoing gift is he offered to distribute that money among the district attorney's offices, a good portion across the state for all the DA's offices outside of the 5 boroughs of New York State. And so what he did was allocated a certain number based on the arraignments that we have in each county. And what he did was allocated the sum of $239,094 to Greene County if we could show that that would be an appropriate number that we could use. Well, certainly I had no problem coming up with that number. In fact, I think I came up with about 400,000 or 500,000, maybe even more. And we filled out those applications. And in fact, they told me, well, you can only go to 294, get rid of all those other numbers. And my response was, well, that's fine, but if you look at my application and all the items that I delegate the money toward, if you say, well, no, we don't approve this, I don't want my amount reduced. I want the opportunity to come back and substitute my additional funds. And in fact, that application went in and we were in fact approved for that full amount. So that grant has been allocated to Greene County here. We do have the $239,094. It's not as much as we could use, certainly, but we are very appreciative of it. And I think it's up to our board now to agree to accept that sum. It is a grant. It's nothing that has to be paid back. That's where we are as far as.
I understand we get received the money and cash the check.
Okay, great. All right. Any questions?
So you're saying we should approve this?
All in favor, say aye.
Thank you.
Yeah, it will, obviously, it will require an accounting adjustment to Joe's department, whether or not we move it all into fiscal this year or save something next year, depending on what, how we can expand it, or we just take the money and run and let it run the fund out. So we've already, all his expenses have already been made, they've already been done, so. And then Cyrus is not running for further election anywhere else.
Good news. He is not.
I understand there might be a position open next November, but.
Well, believe me, there are about 12 candidates in Manhattan seeking that position. And each candidate is arguing that one is more progressive than the next. So it would be a total change of pace.
Chairman?
Not to be left out, Randy. Tommy?
Two quick stories. Dispatcher last week answered the 911 phone, and it was a husband that witnessed his wife going to a cardiac arrest. He performed 8 to 10 minutes worth of CPR on the phone before EMS arrived, and the woman made it, was transported to the hospital. Hopefully she'll be walking out of the hospital. So that was one good story. Tuesday morning, about 2:30, 3 o'clock in the morning, dispatcher had answered a phone with a frantic woman that was in labor. The dispatcher delivered the baby. Mother and baby are fine, even before EMS arrived on scene. So.
What they named the baby?
I don't know.
Nice to hear good stories for a change. Thank you.
Call count for the month of April, there was 2,312 calls for service that we catted in the 911 center. I was able and started April 1, breaking out mutual aid calls, fire versus EMS. There was 2 mutual aid fire calls and 20 EMS mutual aid calls. I do not have where they were and what towns, etc. Real quick, we answered the phone in the month of April 3,927 times between 911, admin emergency, and administration lines that come into the 911 center. And then roughly 3 to 4 months ago, I had a separate line brought in from the sheriff's office. It's a rollover line, and we answered that 353 times. They're pretty active out there. When I had left, seemed to be pretty busy today. So the rain is creating havoc on some of the fire departments out there, and pump outs, et cetera. As well as highway departments, because as the ground gets soggier, the trees fall on the power lines, and so we're involved with making notifications to the utility companies, et cetera. That's it. Anything? Great,
Thank
thank
you.
you.
Thanks. Thanks. Okay, now move along on the resolution. First resolution, is amending resolution number 54-21, appointing members to the Greene County Fire Advisory Board, 2021. Leonard?
Handle.
Handle seconds it, all in favor?
Aye.
Opposed? That's carried. Second resolution, budget amendment, Greene County District Attorney Discovery Reform Funding Plan. I'd like to make that, who'd like to second?
Handle.
Bloomer.
Bloomer and Handle? Handle and Bloomer. All in favor?
Aye.
Opposed? That's also carried. That's all the resolutions we have. Is there anything else to come before public safety tonight?
Motion to close, Mr. Chairman.
I'll second that.
We're closed. Thank you very much.
Thank you.
Again, if anybody would want to see that scan by scan, see if it, just come